Hi everyone, today I am back with another set of fascial maneuvers that we are going to do together. It is a wonderful day outside, it's sunny, it's breezy, and it feels amazing. So let's do the fascial maneuvers today. And so we will be doing different set of fascial maneuvers. We will be beginning with the stress reset, that is the palette swipe, totally twisted, and anti-gravity. Okay, then we are going to move on to the maneuvers for the head, face and neck. Then we will be winding everything up and bringing everything together by doing the organ reset. So it's going to be an amazing set of fascial maneuvers which we will do today. So let's directly get into the stress reset. So first we will be doing the palette swipe. Now palette swipe is a very powerful fascial maneuver which you can do any time of the day, and it really helps to reduce the tension in your zone 1, that is the head and the neck, while also reducing the tension in your zone 2, that is the torso, and the zone 3, that is your leg, pelvis and the legs. So by working on the zone 1, we are releasing the tension in the head, the neck, your jaw, and you might feel that your ears open up and you can feel and hear better, you can see better, and it will improve your mental clarity and the focus. So if you have vertigo, dizziness, if you want to decompress your spine, also if you have compression in the C1, C2 at the base of the skull, so this is where the compression happens. So we can do the palette swipe for that. So palette swipe can be done in two ways. That is, we can do the swiping of the palette, that is the roof of your mouth, with your tongue. If you do not like to put your finger, thumb in your mouth, then you can do it with your tongue. But the most effect is only by pushing your right thumb onto the roof of your mouth, that is your palate, and swiping it firmly, not painfully but firmly, from right to left, from your right molar to your left molar. So this has the most effect, and it is mostly recommended to do it with your thumb. So now let's get into it directly. Stand with your feet shoulders width apart. You are going to engage your spinal pelvic lock in. Push your belly button to your spine or hold your sex organs up. Now we are going to cross our right feet over the left feet like this. If you have balance issues, just widen your feet and you can have the balance for that. Or if not, you can just do the maneuvers seated. So we are going to do it standing today. So I'm crossing my right feet over the left feet, engaging my spinal pelvic lock in, my right hand on top of my left shoulder, my left hand on top of my right shoulder. Now I'm going to take out my right thumb and I'm going to swipe the palate of that is the roof of my mouth, from right to left, from my right molar to the left molar, with a firm pressure. So it's not going to be painful, so just watch out for your nails and just wipe with your thumb. Okay, so we are going to swipe together. So 1, 2, 3, 4, 5, and 6. Okay, now we are going to unwind and we will walk around. So I'm going to walk in a figure 8. We walk in a figure 8 to integrate the changes that we just did in our body. And after doing the palette swipe, I'm having that release in my neck and my head. So I can feel my head clear up. So much it has to do with your emotions as well. If you have racing thoughts or emotions come up too much, then you can do the palette swipe, and it relaxes your brain and makes you come back into your body. Also, you will feel that grounded on the feet, so on the floor. So I can feel my feet grounded and all my toes on the ground. Now let's move on to the next one, that is the totally twisted. So totally twisted is a full body fascial reset. So not only releasing the tension in your head, neck, but also your torso and your legs. So we are going to rotate in counter clockwise, counter rotation. We are going to do counter rotation, head to one side, body to one side, hips on one side and legs on one side. So we are just ringing in like a tal and twisting our body like we're ringing a tal. So what we are doing by doing the totally twisted is we are calming our entire body, and this is going to relax your mind so much. When you do it, by the 6th breath, you will feel your brain and your nervous system calm down, and you are decompressing your spine, your digestive organs, you are opening up your hips and blood circulation in your hips. Also, this will reduce the tension in your shoulders and your neck and ears. So let's get into the totally twisted. Stand with your feet shoulders width apart. Engage your spinal pelvic lock in. Now cross your right feet over your left feet. Now totally twisted is also going to improve your breathing function, because we are going to twist and we are going to breathe in through different ways. So okay, let's just discuss the breathing first. So we are going to do 3 types of different breathing patterns. We are going to breathe in through the nose, out through the mouth, or out through the nose. Then we are going to do 3 staged breaths, that is breathe in through the mouth, hold, breathe in more, hold, breathe in more, hold. We are going to twist further and we are going to exhale out through the mouth. Then we are going to repeat this 2 more times, so making it a 3 total. Then we are going to breathe in through the nose and out through the mouth, and this is going to calm your entire body with your brain. So I can already feel that sensation of calmness just by saying it, because my body is so much into the fascial maneuvers. I do it every single day to relax my body, and I can do it in the morning to improve and have a stress free day, and then I can do it at night to unwind my body and have a good sleep. So now let's just get into the totally twisted. Standing with your feet shoulders width apart. Engage your spinal pelvic lock in. Pull your sex organs up. Now cross your right feet over your left feet. Again, if you have balance issues, you can widen your feet, or you can do this maneuver seated. And or what you can do is you are going to step back with your left feet. So anyways, it's going to bring your right feet forward. So these are the 3 ways you can do it. So for now, I'm going to just cross my right feet over my left feet. Engage my spinal pelvic lock in, straighten my spine. My right arm will go under my left armpit. My left arm on top of my right shoulder, or my on the right shoulder. You can now hold yourself firmly and just hug yourself. Now this position is about the connecting you to your fetal self when you are in the womb. So this is the fetal position. Okay, now let's turn our head to the left slowly. Turn your body to the right. Now breathe in, and you're going to stick your tongue in your left cheek and finding a tension spot. So stick your tongue in the left cheek like this, and we are going to breathe together in through the nose and out through the nose. So 6 times. So stick your tongue in the left cheek, breathe in through the nose, out through the nose. In through the nose, out through the nose. In through the nose, out through the nose. In, out. With every exhale, try to turn your body more to the right and head to the left. So breathe in through the nose, out, in, out. Relax your tongue. Now purse in your lips like you want to sip in through a straw. So we are going to purse our lips and breathe in through the mouth and hold. So breathe in through the mouth, hold, breathe in more, hold, breathe in more, hold, breathe in, hold, twist further, body to the right, head to the left, and exhale through the mouth. Now breathe in through the mouth, hold, breathe in more, hold, twist, exhale. Twist further, breathe in through the mouth, hold, breathe in more, twist, and exhale. Relax your shoulders, twist further. Now we are going to breathe in through the nose and out through the mouth 6 times. For this, lock your eyes on one place over your left shoulders. It can be on the left side on the ground. And don't close your eyes. This will help you to maintain the balance. So breathe in through the nose, out through the mouth. In through the nose, out through the mouth. In, out, in, out, in, out. In through the nose, out. And slowly come back to center. Keep your hands and legs where they are. You can readjust your feet if you like. And engage your spinal pelvic lock in. Relax your shoulders. Now we are going to turn our head to the right slowly and turn your body to the left. Now stick your tongue in the right cheek and breathe in through the nose and out through the nose. So stick the tongue in the right cheek. Breathe in through the nose, out through the nose. In through the nose, out through the nose. In through the nose, out. In, out. In, out. In, out. Now twist your body further to the left, turn your head more to the right, engage your spinal pelvic lock in, and with every exhale, allow your body to melt the stress away. So now breathe in through the mouth, hold, breathe in more, hold, breathe in more, hold, twist further, and exhale out through the mouth. Breathe in through the mouth, hold, more, twist, and exhale through the mouth. Now we're going to breathe in through the mouth, hold, breathe in more, one more, hold and twist, exhale. Now lock your eyes at one place over your right shoulder on the ground. Breathe in through the nose, out through the mouth, in through the nose, out through the mouth, in through the nose, out through the mouth, in, out, in, out, in, out. One more, breathe in, out. Now we are going to advance this. Hold yourself firmly, turn your head to the right, body to the left, engage your spinal pelvic lock in. Now we are going to breathe in through the mouth, doing the 3-stage breaths. So breathe in, hold, breathe in more, breathe in more. Now hold and bend forward, hinging at the hips. Slowly bend your body forwards. How much ever you can. Turn your head to the right, body to the left. Breathe out through the mouth. Now breathe in through the mouth, out through the mouth. In through the mouth, out through the mouth. In through the mouth, out through the mouth. Now slowly bend your knees and twist further, body to the left and head to the right. Breathe in through the mouth, out through the mouth. In, out, in, out. Now say, I feel safe, I am protected, and I love myself. Now slowly unwind, slowly come up and relax your arms, unwind, shake your hands, and we are going to walk. You might feel lightheaded after this because pressure is moving in our body through different zones, and it is allowing the stress to melt away. Also, you might feel a tension at the back of your knees. If you're having a lot of tension in your hips or your knees, you can do these maneuvers seated, or you can widen your feet. Also, you can do it in another way, which we will be discussing while doing it on the other side. Okay, so if you do not have space to walk in a figure eight, you can just sway from side to side. It helps to come back into your body. And once you are back into your body and you're ready to move forward with the maneuver, now we're going to stand, do it on the other side. Stand with your feet shoulders width apart. Engage your spinal pelvic lock in. Now we are going to cross our left feet over the right feet. So like we discussed before, like if you cannot cross your feet, you can move back with your left feet, or you can move back with your right feet, depending on which feet you want to have forward. Okay, so now for this we are going to cross our left feet over the right feet, and we are going to cross our left hand under our right armpit and a right hand on top of our left arm or shoulder. Now we are going to engage our spinal pelvic lock in, and we are going to turn our head to the right this time, and turn your body slowly to the left. Stick your tongue in the right cheek like before, and we are going to breathe in through the nose and out through the nose. So stick your tongue in the right cheek and breathe in through the nose, out through the nose, in through the nose, out through the nose, in through the nose, out through the nose, in, out, in, out, in, out. Now hold yourself firmly. Engage your spinal pelvic lock in. Turn your head more to the right and body to the left. And we are going to purse our lips and breathe in through the mouth. So breathe in through the mouth. Hold, breathe in more. Breathe in more. Hold, twist further and exhale through the mouth. Breathe in through the mouth. Hold, breathe in more. Hold, breathe in more. Exhale. Now breathe in through the mouth. Hold, breathe in more. Breathe in more. Hold, twist further, head to the right, body to the left, and exhale through the mouth. Relax your shoulders, engage your spinal pelvic lock in. Head to the right, body to the left. Now breathe in through the nose and out through the mouth. Lock your eyes at one place over your right shoulder. Breathe in through the nose. Out through the mouth. In through the nose. Out through the mouth. In through the nose. Out. In. Out. In. Out. One last time, breathe in. Out. Slowly come back to center. Readjust your feet. Keep the toes on the ground. Engage your spinal pelvic lock in. Hold yourself. Hug yourself like this firmly. Now slowly turn your head to the left and your body to the right. So we are going to stick our tongue in the left cheek and breathe in through the nose and out through the nose. Okay, so breathe in through the nose, out through the nose, in through the nose, out, in, out, in, out. Twist further, breathe in, out. Relax your tongue. Now purse your lips and breathe in through the mouth, and we are going to do 3 stage breaths. So purse your lips, breathe in through the mouth. Hold, twist, breathe in more. Hold, breathe in more. Twist further and exhale. Breathe in through the mouth. Hold, breathe in more. More. Hold and exhale. Relax your shoulders. Engage your spinal pelvic lock in. Twist further to the body to the right and head to the left. Breathe in through the mouth. Hold. More. One more. Exhale. It's normal to feel lightheaded because you are allowing the stress to go from your body here. Now keep your eyes open, turn your body to the right, head to the left more, and engage your spinal pelvic lock in. Now lock your eyes at one place over your left shoulder on the ground, and breathe in through the nose, out through the mouth, in through the nose, out to the mouth, in through the nose, out through the mouth, in through the nose, out, in, out. Now we are going to advance the movement. So breathe in through the mouth, hold, breathe in more, breathe in more. Now hold that and hinge at the hips, bend forwards, fold forwards, how much ever you can. Turn your body to the right, head to the left, and breathe, breathe out. Now twist more and breathe in through the mouth, out. In through the mouth, out through the mouth. In, out. In, out. In, out. In, out. Slowly come up. Oof. And unwind. Take a moment to come back into your body. Shake your arms and your legs. And we are going to walk in a figure 8 to integrate the changes. Now you may notice that one side of the body will feel more stiffer or difficult to twist as compared to the other side of the body. So it is completely normal, and we will get into different movements that will help to open up those restricted areas of the body. Also, if you are feeling the tension at the back of your knees, we can do the maneuvers for that as well. That will help to open up your hips, improve the circulation to your legs, and relieve you of that pressure. So the pain that you're feeling is the pressure moving in your body as the stress goes away. So it is a good sign. So now we are done with the totally twisted. We will be doing the anti-gravity as our next fascial maneuver. So anti-gravity is a full body and it is a full spinal decompression that targets mainly your torso. So not only your torso, but it will also cause a release in your head, neck and shoulders with your lower body. So when we do the anti-gravity, we are creating more space for the organs, we are allowing more space for the bones, and we are preventing stagnation in the digestive organs. So if you have any bowel issues or digestive issues, doing anti-gravity will help you with addressing those issues. And if you can just do one maneuver in your day, if you are very busy, I would recommend you to go for anti-gravity, because it helps to clear up your brain fog, your anxiety, and just improves that blood circulation in your entire body, especially your torso, because it is going to improve your breathing function and open up your lungs and expand your rib cage while decompressing your spine. Now let's do the anti-gravity. So stand with your feet shoulders width apart. Engage your spinal pelvic lock in. Push your belly button to your spine. So once you feel that your spine is straight now, let's interlock our fingers and our hands like this. So it is important that you touch your thumb together. If you cannot touch it, it's okay. Over time you'll be able to touch your thumbs too. So just interlock your fingers and go at the back of your neck, at the base of your skull. So you're going to do it like this, and we're going to pull the skin up on the neck, and we're going to lock it at the base of the skull like this. Okay, so feet shoulders width apart, engaging the spinal pelvic lock in, pulling the skin at the back of my neck with my interlocked fingers and locking it at the base of my skull. I'm going to open up my elbows and chest out, shoulders back, looking up, straighten my spine, spinal pelvic lock in. Breathe in through the mouth, out through the mouth. In through the mouth, out through the mouth. In through the mouth, out through the mouth. Now breathe in through the nose, out through the mouth. In through the nose, out through the mouth. In through the nose, out through the mouth. Now slowly bring your chin to chest and bring your elbows in. So tuck your elbows and your chin. Engage your spinal pelvic lock in. Now we are going to breathe. Keep pulling the skin at the back of your neck. Breathe in through the mouth. Look to the right with your chin tucked like this. Hold it and look to the right as far as you can, and come back to center and exhale. Now breathe in through the mouth. Hold it, look to the left with your chin tucked as far as you can, and then come back to center and exhale. Now we are going to repeat this 2 more times. Breathe in through the mouth. Right. Down, exhale. Breathe in through the mouth. Look to the left. Come down and exhale. In through the mouth. Right. Exhale. In. Left. Exhale. Now you're going to keep pulling the skin at the back of your neck. You're going to bend our knees and widen our stance first, and then we are going to bend our knees, push our butt back and come into a skier squat. And with that, you are going to push your chin away from your hips and open your elbows wide. Now breathe in through the mouth. Hold it and look to the right as far as you can, and come back to center and exhale. Breathe in through the mouth. Look to the left as far as you can and come back and exhale. Breathe in through the mouth. Right. Come down, exhale. In through the mouth. Left. Exhale. In. Right and exhale. In. Left. Down. Exhale. Now we are going into a full squat. If you cannot go into a full squat, you can just tuck your elbows and your chin like this, bend your knees and curl like this. And we are going to breathe in through the mouth and out through the mouth, and in through the nose and out through the mouth. So you can either do this or go into a full squat by pulling the skin at the back of your neck. I'm going into a full squat now. And if you are in a full squat, you're going to curl yourself like this in between your knees. Tuck your chin and elbows in between your knees and hold yourself with your knees. Now breathe in through the mouth, out through the mouth, in through the mouth, out through the mouth, in through the mouth, out. Now breathe in through the nose, out through the mouth, in through the nose, out through the mouth, in, out. Now slowly lift your butt up. Keep your head hanging down, your elbows down. We are going to wait here for a second. And then slowly uncurl one vertebrae at a time. Your head being the last thing to come up. Slowly open your arms. Look up to the sky. Enjoy that sensation. Wait for it. And you're going to relax, unwind. Shake your hands, your legs, getting all sweaty. This really, improves your metabolism and makes you so high that it's like I feel sometimes that I've gone for a run. So we are walking to integrate the changes. Walk after every maneuver to integrate the changes. Now I'm making a opposite 8. So for the camera I'm making a small 8, but you can make a big figure 8 pattern to walk more. And this will help you come back into your body and adjust and incorporate the new patterns that you have just made. So after doing the anti-gravity, you'll feel that your feet are more grounded and your spine is straight, and I'm feeling I have like a lot more taller. So if you have posture issues, when you do this, you'll feel that you're not curling like this so much, or you're pushing your head forward. So this will also restrict the breathing and makes you breathe shallow when you are like this. So when you're all straight out and your spine is straight, and that is the natural alignment of your body, then you are able to breathe more efficiently. Also, you're going to feel much better with yourself. Now these were the basic stress reset. Now we are going to do the maneuvers for the face, head and neck. Now let's quickly get into it. We are going to start with peekaboo. Peekaboo is one of the fascial maneuvers for the face which we do that helps with lifting your face, improves the blood circulation to your face and rebalances your face, that is the facial symmetry. Also, we are doing it only on the one side because we are mostly right side dominant. You can try and do it on the other side, but mostly it leads to restriction you'll feel tightening of that part of your body. So we are doing it only on the one side. It is also because of the fact how the fascia wraps around the head, the face and the neck. So we are just rebalancing everything up in our face and the neck. So let's do the peekaboo. Okay, so we are going to stand with the feet shoulders width apart. Engage your spinal pelvic lock in. Hold your P or pull your sex organs up. And with the right hand, you are going to go on the left side of your neck like this. So you can see my hands on the left side of the neck. You are just going to grab the skin from your traps and you're going to pull it back to your neck. Now I'm going to have my head, temples turn into my elbows. So I'm locking my head into my elbows and locking in this place with my right hand. So here I am also having my ears locked and my temple locked. Now this is not to move, okay? Now with the left hand you're going to grab just below the cheekbone and like this, and you're going to push the skin up. It's not exactly straight up, but it's going to go in this direction. So pull the skin just below your cheekbone, keep the grip. You're going to tuck your chin, breathe in through the nose, out through the mouth, in through the nose, out through the mouth, in through the nose, out through the mouth. Now you're going to bend your knees, push your butt back, squat, look to the left down and breathe in through the nose, out through the mouth, in through the nose, out through the mouth, in through the nose, out through the mouth. Now slowly come up and you're going to unwind, shake your hands, and we are going to walk. This releases that tension on the face. If you have anxiety, you have those expression like your face tends to become compressed, and you feel that your face is no longer having that normal symmetry. You can do this to rebalance the face, and it will improve the blood circulation. So now one thing we will clear here is that people have a feeling and that thought that when you stretch the skin on the face, you're going to get wrinkles. But what we are doing here is that we are working with the fascia. Our intention is to work with the fascia, which is just beneath the skin and also in the deeper layers surrounding our bones and inner tissue layers. So when we are stretching the skin on the face, we are not causing the wrinkles, rather we are causing more of the blood circulation in that area, and in opening up the other restricted areas. We are pushing in more nutrients, more oxygen, thereby you are going to feel more lighter, younger, clearer, and it is also going to make you feel your skin become more tight and tightening up like a facelift. So it also gives a natural blush to your face. Okay, now let's get into the another maneuver, which is the antler twist. So antler twist is very powerful for releasing the tension in your head. If you have headaches, if you have dizziness, vertigo, if you have the eye strain, or you want to improve your eyesight, you want to relax your ear, improve your hearing, and also it releases tension in the neck. So when it releases the tension in the neck, it's going to release your shoulders and your hips too. So you will feel that in your entire body, and the sensation of calmness just coming back into your body, and everything becoming quiet on the inside and the outside. So this is very effective for if you haven't slept well, or if you want to sleep well. This is working for both the things by releasing and reducing the tension in the head. So let's do the antler twist. Stand with your feet shoulders width apart, engage your spinal pelvic lock in. Now with the right hand, with the palm of your right hand, you're going to place it on the right side of your temple, fingers facing backwards like this, and the left hand with the palm of your left hand on your left temple, fingers facing forward, just like this. Now we are going to squeeze the head, and by that we are literally going to squeeze the head. So squeeze the head, okay, squeeze your head, and you're going to twist the skin so that your fingers meet at the top. So twist the skin on the side of your head like this and push it slightly up so your fingers meet at the top. Now keep twisting the right hand forward and the left hand backward to not lose the grip. Now engage your spinal pelvic lock in and breathe in through the nose, out through the mouth, and move in all directions. So breathe in through the nose, out through the mouth, relax in through the nose, out through the mouth, look to the side, breathe in through the nose, out through the mouth. Now bend your knees and move from side to side, in through the nose, out through the mouth, in through the nose, out through the mouth, and you're going to shake your hands and relax. Oof. It readjusts your cranial bones in the head and clears up your head so much. I'm feeling so much calmer in my head now. I'm going to walk in a figure eight to integrate the changes. Come back into your body. If you're feeling lightheaded, it's normal. It's just the stress and the pressure moving, leaving your body. Now we are going to do another maneuver for the face, which is getting cheeky. So getting cheeky is we are going to work on the jaw. So your jaw is not just an source of is a part of your face, but it is not only helping you to open your mouth, breathe, and whatever, like eating, everything, but your jaw holds a lot of emotions like when you are in a conflict with someone and you choose to keep quiet, you choose not to say anything to avoid the conflict. So all those emotions store in your jaw, like you would be thinking, I would have said this, I should have said this, and I could have said this. All that stores in your jaw, and you get a tight jaw over time, clenching of the jaw, TMJ, or jaw pain, or locked jaw, which also tightens up your ears over time, causing a block sensation in your ears and your neck, your shoulders, plus your hips. So this will also help you to walk more freely, and it will also help you to align your hips. So when you release the jaw, you are releasing your hips and your ankles. So let's see the changes ourselves. Now stand with your feet shoulders width apart. Engage your spinal pelvic lock in. Now we are going to place our fingertips of our right hand, or fingers facing backward, on the midi part just below the cheekbone. I'm going to place it like this in the midi part, where I can press and I can feel that fleshy part. Okay, and with the right hand, with the left hand, fingers facing forward, with the fingertips I'm going to place it on the just below the cheekbone in the midi part. Now right hand fingers facing backward, left hand fingers facing forward. You're going to squeeze in the skin and twist to make like this, so that your elbows meet at the bottom. Now we're going to breathe in through the nose and out through the mouth, and move from side to side. Breathe in through the nose, out through the mouth, in through the nose, out through the mouth. Move in all directions. Breathe in through the nose, out through the mouth. Now squat. Breathe in through the nose, out through the mouth, in, out, in, out. So if you lose your grip, you can again regain the grip and do this again. Now you're going to open your mouth 3 times. And then you're going to stand straight, and you're going to unwind and shake out your hands. Now just move your jaw. Open your mouth and move. Try to move your jaw and see the flexibility, how it has improved. You might have a tension in this part where your jaw and where there is a joint of your jaw. So move it, and I can feel the relaxation going down to my neck and shoulders. So now we are going to walk, and as you walk, you will feel that your hips have also aligned, and you're feeling a lot more balance with your hips and your feet. Feel your ankles. Now this maneuver not only helps to release the physical tension, but also releases the emotional tension stored in the jaw of not speaking up, of not able to open up with your emotions. Over time, you're going to be more relaxed with your emotional and your physical well-being. Now let's get on to the another maneuver. So we have done the peekaboo, we have done the antler twist, we have done getting cheeky. Now we are going on to so let's do the vagus nerve. So vagus nerve is like a highway for your body for moving all the signals and the blood circulation and the signals to every part of your body efficiently. So let's consider the situation like there is a highway, and the highway is blocked with traffic. Now you can go with take another route and go, but you will be reaching much slower as compared to your original route. Now it's the same thing is with your vagus nerve. When the vagus nerve is restricted, you will have signals going into different organs of your body slower, and because of that you might feel lots of anxiety coming up, or those stress bites, and also your shoulder pain, your neck pain, also with your hips. Now this helps to open up your shoulders, relaxing your rib cage and opening up your rib cage, because when we are not breathing, doing deep breathing, we are breathing shallow and not focusing on breathing in through the nose, or the deep breathing. We are breathing shallow, and mostly it happens that we are breathing in through the mouth. So because of that, your first rib tends to get restricted over time, and we are releasing the rib cage by doing this, and also the stress. So if you have stress and anxiety, this is a very powerful maneuver. Just try it yourself. Now we stand with the feet shoulders width apart. We are going to do it on the left side first with our right hand. So just go with your right hand, the fingertips of your right hand just above the collarbone of your left side. Find your collarbone, and just above that you're going to press on the traps. So push in, twist the skin, and push the skin outward to your left shoulder. Now lock that in place. Now with your left hand, just you can place it on your chin, on the side of your chin, and turn your head to the right, away from your left shoulder, creating a maximum stretch between your chin and your left shoulder. Now look up diagonally, push your chin up, look up, and now there is so much of space between my left shoulder and my chin. Now I'm going to squat, turn my body to the left and look to the right. Breathe in through the nose, out through the mouth. In through the nose, out through the mouth. In through the nose, out through the mouth. Now you can move and breathe in through the nose, out through the mouth. In through the nose, out through the mouth. In, out, and we are going to come up slowly and unwind. Shake your hands, and suddenly there is so much of clarity in your brain, in your head. I can see the room more clearer now. I can hear better with this, because we are clearing that highway and allowing the smoother movement of the signals and the quicker movement of the signals throughout the body. Now we are going to do it on the left side, on the right side with our left hand. So with your fingertips of your left hand, you are going to press in just above your collarbone on the traps. Engage your spinal pelvic lock in. So push in with your fingertips over on your traps. Twist the skin, and you're going to turn and push the skin out gently. It's not just pressing too hard, just slide the skin out and just lock it there. Do not keep sliding, you lose the grip. So just lock it there, and you're going to, with the right hand on your cheek, put it on your cheek, and turn your head to the left, away from your right shoulder. Look up diagonally, turn your head more to the left. Now create more space in between your cheek and your chin and your right shoulder. Now squat, look to the left and turn your body to the right. So breathe in through the nose, out through the mouth. In through the nose, out through the mouth. In, out. Now move and breathe in through the nose, out through the mouth. In through the nose, out. In, out. Slowly come up and unwind. Shake your hands. Whoa, that blood rush to my head, that feeling of high. Walk to integrate the changes, or move from side to side. Now this is helping me to see more clearer, hear more clearer, and think more clearer. And also I am feeling that rush of feel good hormones. So I am feeling high right now, You might be feeling it too. Also, if you're feeling lightheaded, it is normal, because stress leaving your body calms down your nervous system. So this is normal and nothing to worry about. Now let's do the sinus release. So sinus release, as the name says, not only releases your sinus, but also what happens is that over time, and when you are lacking movement, or if you're having posture issues, your head will move forwards and you tend to have this posture, and then there is a blockage in your this portion, which will restrict the breathing pattern, and which will also cause compression in your sinus, your spine, as well as it will not allow your breathing to, your ribcage to open up properly as you breathe. So we are going to release everything, and with this we are also going to improve the breathing. If you have any breathing difficulties, like you have a blocked nose, or if you have cold, also this is going to work amazingly for that. So I do this every morning when I wake up, and it immediately calms my nervous system down by improving the breathing and helping me feel much happier and more energetic to start the day. You can do it before going to bed as well. It will help you to breathe efficiently while you are in a deep sleep, and somehow it can also help you to prevent snoring. Those who have issues with the snoring, try this, and this will really help you to avoid snoring as well, because snoring also happens when you have shallow breathing, or when you're breathing in through the mouth. There is so much of compression in your nasal passages and in your breathing everything. So this will help to release everything. Now let's do it. With the right hand, you are going to go on the left, pin the left nostril, and on the ridge of your left nostril you're going to pin it like this, and your thumb at the back like this. Now we have pinned the nose and we have locked it in place. Now the left hand, you're going to place it just below the cheekbone, just beside the fingers of your right hand, and push the skin back. Okay, now you're going to keep it locked like this, your nostrils locked, your left hand locked. Now you're going to breathe in through the nose and out through the mouth, and move in all directions slowly. So breathe in and through the nose and out through the mouth 6 times. Breathe with me. You can even squat. Move from side to side. Now shake your hands and unwind. Now notice that clarity in your head and the nasal passage. So now take a deep breath in through the nose. What do you feel? Do you feel more air on the left side of your body and your left lungs open up? I feel that my left chest is able to get more air, and left lungs, and my left nostril, and the left side of my head with my ears. Now not only this, now start walking. Now as you walk, you can feel that release has gone down to your left rib cage, to your down, and your left hips. If you tune into your body, and you can feel the changes exactly, I can feel the changes go down to my side of my left leg as well. So this is not just a sinus release, it is a powerful maneuver to improve your breathing and blood circulation in your entire body. Now let's do it on the right side with our left hand. So with your left fingertips, you're going to pin the right nostril like this on the ridge of your right side of your nose, and pin your thumb at the back like this. Now it is locked, and with my right hand under the cheekbone, grab the skin and pull it back. Breathe in through the nose out to the mouth and move in all directions. So breathe with me. Squat and move. And relax, shake your hands. Now let's walk. Feel how your right side has also opened up like your left side. Now there is so much of air in both sides of your body. Oof. The tension in the head has reduced, the tension in the neck has also reduced, and I feel my shoulders have dropped down. Now about your nervous system. This calms down your nervous system so much, pushing in all that oxygen into your brain and giving you a sense of relief. So if you have trouble breathing or difficulty and congestion in your nasal passage, try this. This works amazing. Now let's move on to the one more maneuver for the face, neck and head, which is the double ear pull. So double ear pull, we are going to pull our ears up and we are going to pull our ears down, and we are going to move in all directions, and we are going to breathe in through the nose and out through the mouth, and out through into the mouth and out through the mouth. So this is a very powerful maneuver, which is also not only going to open up your ears, that block sensation, or your sinuses and your neck, release your jaw, neck, ears, shoulder, your hips and your feet. But also what happens is that it is going to improve the circulation in your entire ear. If you have tinnitus, this is going to work amazingly for that. So we are just going to release the tension. Also you can check if you have a lot of restriction in your ears or not. If your ears are clogged or congested, just take your left hand and on your left ears just place it like this, and you're going to try to fold your ears and feel the tension in your ears. If you can feel your ears are tight, or there is some restriction in your jaw, you'll feel it to your jaw. Okay, so we are going to get into the maneuver. With your entire palm of both the hands, you're going to grab your ears like this. So wrap around your ears like this. Wrap it like this with your entire palm. If you have sweaty hands or sweaty ears, you can wear a socks or a glove or use a cloth to grab your ears so that you don't lose the grip. Now we are going to grab the ears like this, and we are going to pull the ears up. It's like pulling your ears up and away from your shoulders. So pull the ears up, you feel a stretch in your jaw. Okay, now you're going to look up and breathe in through the mouth. Breathe in through the mouth, out through the mouth, in through the mouth, out through the mouth, in through the mouth, out through the mouth, in through the nose, out through the mouth, in through the nose, out, in, out. Now we are going to tuck our chin to chest, but we are not going to bring our body forward. We are just going to keep pulling the ears. We are going to tuck our chin to chest and keep our shoulders high, and only pull the ears down. So pull the ears down. Regrip again if you lose the grip. Shoulders back, pull the ears down, chin to chest, breathe in through the mouth, out through the mouth, in through the mouth, out through the mouth, in through the mouth, out. Now in through the nose, out through the mouth, in, out through the mouth, in, out. Now slowly lift your head and you're going to squat. Keep pulling your ears and you're going to squat and breathe in through the mouth. Look to the right and come down to center and exhale. Breathe in through the mouth. Hold, look to the left, come down and exhale. Breathe in, right, down, exhale. In, left, down, exhale. And slowly come up and you're going to turn from right to left, opening your mouth 3 times. So open your mouth 3 times on each side. So look to the right, open your mouth 3 times, close, open, close, open, close. Now look to the left, open and close your mouth 3 times. Look up, open and close your mouth 3 times. Look down, open and close your mouth 3 times. Now relax and shake your hands. Notice the silence that you feel after doing this. Can you feel that quiet inside your body and outside? I feel so much of quietness. It's like the silence in me and the silence surrounding me outside. It helps to tune into your body, come back into your body, come back to present with your body, and it helps you to feel amazing. Now we are going to walk to integrate the changes. So we are going to walk in a figure 8. So also we are going to lock in all the maneuvers and all the changes we have done so far in the body with the new pattern. Now walking in a opposite direction, making an 8. So this is only not going to bring your body back to balance, but it is also going to balance the internal pressure with the external movement and lock in all those changes that we just did. So this is a signal for your body that and your brain that these are the changes, and save it and lock it in place. Now let's do the final reset for today, which is the organ reset. So we are going to get into the organ reset. So every organ in our body has the electrical component and the mechanical component. So we are going to charge our organs with our hands, and by working on the organs, we are not only allowing the organs to function more efficiently, and we are also releasing the emotions that gets stored in our organs, in different organs, and different organs, different emotions. Now let's do the organ reset. So first we are going to rub our hands like this together. What we are doing is we are creating friction between the hands and electricity in between the hands, because every cell in our body conducts electricity. Now rub your finger knuckles together, rub your other knuckles together, rub your fingernails together. Okay, now you can feel the energy in between your hands. So just feel the energy in between your hands. Just close your eyes and feel it. If you can feel it, this is the magnetic field and the electricity and the energy that you just generated with your hands. And if you cannot feel it, it's completely alright. Now let's get into the maneuver. First we will be doing the ileocecal valve. So ileocecal valve is in between your belly button and your right hip bone. So you find the tension spot and we are going to work on that. So what is ileocecal valve? It is a bridge between the small intestine and the large intestine. It is like a sphincter and a flap that opens and closes regularly. So if this flap does not open and close regularly, for example, if it stays closed, then you will have a lot of bloating and indigestion. If the flap remains open, then there will be so much of bacteria moving from the small intestine into the large intestine, leading to leading to the loose stools, and which will lose your bowel movements. Now let's do the ileocecal valve reset. So please engage your spinal pelvic lock in first and have a comfortable feet position. Then place your fingertips on your belly button. Move 2 inches to the right and 1 inch down. It is also in between your belly button and your right hip bone. So somewhere in between that, you have to, with the fingertips of your right hand, not your nails, you're going to place it like this, palm facing upwards towards you. Just push in the spot. If you feel tender, that is the spot. Now you're going to twist the skin to make a thumbs up. Now hold that tension with your right hand. With your left hand will come on your traps and your shoulders like this. You're going to engage your spinal pelvic lock in. Breathe in through the mouth, out through the mouth, in through the mouth, out through the mouth, in through the mouth, out through the mouth, in through the nose, out through the mouth, in through the nose, out, in, out. This position and this place is about holding your emotions, like we can say that it is about holding grief. So say with me, I no longer want to hold grief in my body, or I am letting the grief go now. So breathe in through the mouth, out. Now shake your hands. Now let's walk. This also releases the tension in your right hip. So as you walk, you can feel the tension in your right hip relaxing. If you have any bowel issues like irritable bowel syndrome, if you have gas, bloating, distension, or emotional overwhelm like grief, then you can work on the ileocecal valve. And also it is essential to work on this. You can do it before the meals or after the meals. It helps to reduce and relieve you of that internal intestinal and the digestive, or pressure in the digestive organs. Now and ease the digestion. Now we are going on to the next part, which is the liver and the gallbladder. Liver is about anger, frustration, rage. Gallbladder is about the emotions like guilt and resentment. So these are the emotional connection with the liver and the gallbladder. But let's go on to the main function of the gallbladder. Gallbladder is it releases the enzymes like bile for digestion. Now the gallbladder meridian goes from your forehead to your ears, down to your trapezius, your scapula, and into your pelvis, your IT band, and it will go down to the legs, to your fourth and the fifth toe, between the fourth and the fifth toe of your feet. So it is on both the sides, and this is the most dominant meridian of your body, the gallbladder meridian, which runs throughout your body on both the sides. So we are going to release the tension in the gallbladder. Now the liver. Liver is one of the organs that helps to detoxify. It helps to metabolize the drugs by using the enzyme. It helps in digestion. But if the liver is not working properly, or it is overactive, or it is underactive, then you will have a feeling of sluggish feeling after eating. Also you will have gas, bloating, you will have indigestion, you will have a decreased immune function, you will feel low on the energy, and detoxification will not happen properly in your body. So let's do the gallbladder and the liver reset together. With your right hand, you're going to place your fingertips just below your rib cage, where your rib cage ends, and you're going to press in with your fingertips, palm facing up like this. So on the fleshy part, just where your rib cage ends, push in gently and twist to make a thumbs up. Left hand goes on your traps like this. You're going to engage a spinal pelvic lock in. Breathe in through the mouth, out, in, out, in through the mouth, out. Now look to the left and turn your body to the right. Breathe in through the nose, out through the mouth, in through the nose, out through the mouth, in through the nose, out through the mouth. Now slowly come back to center. Keep your hands where they are, and we are going to say affirmation. I no longer want to hold anger in my body. I am allowing it to go now. Breathe in through the mouth, out. Now say with me. I no longer want to hold resentment in my body. I am ready to let it go now. Breathe in, out. Now shake your hands and feel that sensation of relaxation coming into your body. Walk to integrate the changes. Now let's move on to the next part, which is the stomach. So stomach is not only about digestion, grinding of the food for absorption of the nutrients in your intestines, breakdown of the food, but also it has so much of energy, like it provides you with motivation, desire, belief. So stomach is about belief, and we are going to work on the digestive organ, the stomach, so to improve our digestion, to tune it out into our body, to relax the organ, to create more space and help with the digestion. Because if your stomach is inactive and if there is too much of activity in the stomach, it can cause production of ulcers and increasing your anxiety if the stomach is overactive. And if the stomach is underactive, then you will have lots of indigestion, then there is so much of gas and bloating because of that. So let's relieve that and let the emotions out. Feet shoulders width apart, engage your spinal pelvic lock in. Now with your right hand, just go beneath your left rib cage. My rib cage ends here, and I'm going to place my hand here. Okay, so you're going to press in and you're going to pull the skin inwards gently. Place your left hand on your traps. Breathe in through the mouth, out through the mouth, in through the mouth, out through the mouth, in, out. Now look to the left, turn your body to the right, breathe in through the nose, out through the mouth, in through the nose, out through the mouth, in through the nose, out through the mouth. Come back to center. Now say with me, I believe in myself. I allow my body to move in my life with motivation and confidence. Or you can say, I activate my desires. Breathe in through the mouth, out through the mouth. Shake your hands. Walk to integrate the changes. This relaxes the stomach so much that if you might feel like burping, or you have release of the gas or relaxation of the stomach, and your digestion settles when you do this. Now let's go on to the valve of Houston, which is on between your belly button and your left hip bone. So we are just going to engage our spinal pelvic lock-in first, and we are going to work on this area. So this area, valve of Houston, which has the small intestine and the large intestine. So it is about digestion, absorption of the nutrients, um, uh, preventing the gas bloating, and also the emotion of, this is the overthinking spot. So we are going to work on this. Now, between the belly button and your hip bone, you're going to place your fingertips like this, or just above the hip bone, left hip bone. Push in and pull the skin up, okay, and maintain that grip. Left hand on the trap, you're going to look to the left, turn your body to the right, breathe in through the mouth, out, in through the mouth, out through the mouth, in through the mouth, out, in through the nose, out through the mouth, in, out, in, out. Slowly come back to center. Now you are going to say, I no longer need to overthink to feel safe, and unwind. Shake your hands, and I'm going to walk in a figure eight. You can walk in the opposite direction, making a figure eight, or in whichever direction you like to make a figure eight, or move in your place to log the changes. Now let's move on to the bladder. So bladder is all about, not only about water retention, excretion, and also about removing the digestive waste. Also it is connected with your lower back and the emotions like fear. So when you have a tight bladder, and when you have restrictions around your bladder, that is the fascia around your bladder constricting the bladder, then you feel like pain. This happens when you are scared. So the emotions of fear causes the bladder to contract. Also, if you have a contracted fascia around the bladder and your bladder is contracted, you will not have the excretion properly. You will have bladder incontinence, then you will not have the waste removal from your body, urinary tract infections, the lower back pain, and also you will have an anterior pelvic tilt. So it also helps to correct the posture of your hips and your pelvis. So let's do the bladder reset. We are going to bend our body forward like this, push your butt back, and you're going to find your bladder above your pubic bone. Just above the pelvis bone, you're going to find your bladder, and if you push in, you feel like you want to pee. So just push in and pull the skin up with your right hand like this, and you're going to push your hips forward, squeezing your glutes like this. Left hand goes on your trap. Now you're going to turn your head to the left and your upper body to the right. Breathe in through the mouth, out through the mouth, in, out, in, out. Breathe in through the nose, out to the mouth, in, out, in, out. Slowly come back to center. Keep your hips forward and say with me, I no longer want to hold fear in my body. I'm letting it all go now. Breathe in through the mouth, out. Relax. Shake your hands and walk to integrate the changes. Now this helps to release the lower back pain as well. So when you are pushing your hips forward and leaning back, you are improving the blood circulation to your lower back and improving the movement of the fascia there and your entire lower body and your pelvis. So we are also releasing that fear, emotions of fear. Now let's go on to the kidneys. So kidneys, both the kidneys, right side and the left side, we are going to work on both the sides. Kidneys are the source of energy for your body. They provide you with so much of energy. By also it will help to balance your emotions, as it works with the hormones. And it works with the hormones. So we have the adrenal glands with the kidneys. Now the adrenal glands releases the hormones like the adrenaline and cortisol. So cortisol is a stress hormone, and it is going to, if you are stressed out and there is too much of cortisol, you're going to have issues with your kidneys and your adrenals. You might have adrenal fatigue, and you will have decreased energy. And if your kidneys are not working properly, then you do not have the excretion properly, which will also cause you to retain more water in your body, which can lead to weight gain and your hormonal imbalance. And also it is going to cause urinary tract infection over time. So it is working in coordination with the bladder for excretion of the digestive waste. Now we are going to stand with the feet shoulders width apart. Engage your spinal pelvic lock in. With your right hand, you are going to place it on the rib cage of your right side rib cage. Wrap around your rib cage at the nipple line and pull the skin downwards. Now left hand you're going to place on your traps. Now with the right hand, keep pulling the skin down. Look to the left. Turn your head to the left and upper body to the right. Now take in 3 sharp breaths through the mouth like this. Hold. Exhale through the mouth. Now breathe in through the mouth. Out through the mouth. In through the mouth. Out through the mouth. In. Out. Breathe in through the nose. Out through the mouth. In through the nose. Out. In. Out. Slowly come back to center. Say, thank you kidneys for powering up my body with energy. Shake your hands. Now let's directly go on to the left side of the kidneys. Wrap your left hand around your left rib cage. Grab your rib cage at the nipple line. Pull the skin downwards and lock it there. Right hand on the traps like this. Place the elbow above your head. Keep pulling the skin down. Turn your head to the right and your body to the left. You're going to take 3 sharp breaths in through the mouth like we did before. So breathe in. Exhale. This is going to charge and power up our kidneys. Now breathe in through the mouth. Out to the mouth. In. Out. In. Out. In through the nose. Out to the mouth. In. Out. In. Out. Come back to center. Say, thank you kidneys. Thank you body for providing me with the energy to move in my life with confidence. And shake out your hands. Now walk to integrate the changes on both the sides. Walk in a figure 8. If you don't have space, move from side to side. This also opens up your rib cage and improves your breathing function, because we are placing our hand just above our rib cage. It's going to open up our rib cage and improve our breathing function. So take in deep breath through the nose and feel how you have so much space in your ribs now, and you are high on energy as well. So it calms down your brain and increases your energy at the same time. Now we are going to do the spleen. So spleen is one of the most important organ in our body, not only for detoxification of the blood, but it also helps in digestion. So, and it is the only organ in the body that grows spontaneously wherever the blood pools and becomes stagnant. So, working on the spleen will not only help you with all these, but will also help you to release the emotion stored up of the worry. If you worry too much, you need to work on your spleen, and it helps you to clear up your head, calm down your anxiety and your body to come back into peace and come back to present. Rather than worrying about anything else, you just come back to present, and in your brings that mental clarity. Also, working on the spleen will help you to improve your hair and nail growth. It is going to improve your skin tone and your skin condition. So if you have any autoimmune conditions relating with your skin also, it's going to work with that as well. So let's do the spleen. Now with my left hand, I'm going to grab just below my rib cage, my waist. So I'm going to grab my waist like this, just below my rib cage. So my rib cage ends here and my hand is here, just below the rib cage. Now the main part is that with my thumb, I go back just beside my spine and I'm going to push in there, just below the rib cage. Now my right hand is going on the traps, and I'm going to tuck my chin to my chest. Okay? And then I'm going to lean to the right to look at my right feet. Now when you do this, you'll feel that with your left thumb pressing on the back of your just beside the spine, there is your spleen, and that's where you want to work. So you're looking for that pressure. So breathe in through the mouth, out, in through the mouth, out, in, out, in through the nose, out through the mouth, in, out, in, out. And say with me, I no longer need to over worry to feel safe. And you're going to unwind, shake your hands and walk. Feel that sensation of calmness in your head. Can you feel your breath come back to normal? Can you feel your ribcage open up? Can you feel your shoulders drop down and your hips loosen up? Because I can feel all that right now. If you feel lightheaded, it's the stress leaving your body. So now let's do the thyroid. So thyroid and the throat. Thyroid is a butterfly shaped gland just above in front of the neck on your throat. So we are going to work on the throat by working on the thyroid. So thyroid and the throat are more about storing your emotions, balancing your hormones for maintaining the body temperature, improving your energy, your function. So if the thyroid is underactive, it leads to hypothyroid, and which slows down your body, and it will also lead to weight gain and a lot of hormonal issues. If you have an overactive thyroid, it will lead to the energy depletion by depleting you of your energy reserves. Now let's work on the thyroid. Also, it helps to communicate and open up with your emotions more freely. And one of the things which we notice nowadays is that people are not able to express their truth. So by working and opening up your throat, you're able to communicate more efficiently, and you are able to speak out the truth and let your emotions out and not let it build over here. So we are going to, with the right hand, grab the skin on the thyroid or your throat and pull the skin gently upward. Left hand, we are going to go back at the neck and we are going to make a circle like this. So go back at the neck and grab your neck and breathe in through the mouth. Close your eyes, breathe in through the mouth, out, in, out, in, out, in through the nose, out through the mouth, in, out, in, out. Now you can say, I speak my truth, the truth from my heart, even when it's inconvenient. I speak my truth. Now relax your hands, shake your hands, and we are going to go. The sensation of coming back into your body and the grounding is so intense after doing this. How your neck relaxes and shoulder drops after this, and your feet feels grounded all the more. Now one final one for the heart and the brain coherence. So we are going to connect our brain and the heart together. We have every day we are just pulled on one side with thoughts in our head and the other feelings in our heart on the opposite direction. So they're just moving in the opposite direction. Now we are going to bring them together. We are going to align the emotions with the thoughts together in one, and we're going to improve the balance. So this will improve your mental clarity, let go of the anxiety, let go of those emotions of those emotions that are settling in your body and your heart, of that void and everything which you feel. It can be too intense for you to feel chest tightening up and all those. It helps to relax all those emotions that are bottling up in your heart and in your head. It also calms down the racing thoughts. Now let's get into it. So place your right hand on your heart center. Now close your eyes and just feel your heartbeat. Can you feel your heartbeat? Now with your left hand, you're going to place your left hand on the top of your head and you're going to feel the brain beat. Feel your brain beat. Now you'll notice that your heartbeat is different and your brain is going somewhere else, and we are going to align the two. Now breathe in through the mouth, out to the mouth, in through the mouth, out, in, out. Breathe in through the nose, out to the mouth. Let it all go. Breathe in through the nose, out through the mouth, in through the nose, out through the mouth. Let the stress melt away. Now keep your hands where they are. Keep your eyes closed. Now bring your attention to your heart. Bring your attention to your head. Come back to heart. Go back to your head. Come back to your heart. And once you are back to your heart, set an intention. You can say, I'm ready to move forward in my life with confidence. I attract the positive and only the positive. I only take in the energy which is positive from the earth. Release the negative back into the earth. Breathe in through the mouth, out through the mouth. Let it go. Now you can say, only peace may enter into my mind. Only peace may enter into my heart. Breathe in through the nose, out through the mouth. Slowly relax your hands. Open your eyes, shake your hands, and come back to center. If you're feeling lightheaded, it's normal. Let's walk to integrate the changes one last time. Integrate the changes. Locking the changes. So, what you're feeling now is a sensation of calmness, of coming back into your body, that sense of relaxation. It's like you're in a bubble and everything is moving away from you, and all the energy is inside your body. You have all the energy and the strength to begin your day or to end your day. Set an intention as you do this every single day. Begin your day with an intention, end your day with an intention. Begin your day with the motivation and the energy, and unwind your day by releasing all the negativity, bringing in forgiveness and generosity. Because when you release the anger and frustration or guilt, resentment from your body, you are going to bring in the forgiveness, bring in the grateful feeling of blessed and blessings, and you will feel the feeling of generosity in your body and the sensation of calmness. So everything comes in together in your body. So this was the organ reset. Do it every day and see the changes for yourself.